Okay, let's talk a little bit about skeletal trauma. Mostly when we're talking about skeletal trauma, we're going to be concerned with fractures. That's a big one for us in X-ray. That's what most people associate us with too. Us meaning radiographic technologists. All right, so let's take a look at a few examples of types of fractures. So here we see incomplete, and that's kind of self-explanatory, meaning that there's a beginning of a fracture here, but it doesn't completely go through the bone. Transverse, on the other hand, does separate the bone into two parts, basically. It's a complete fracture. But the one thing about it is that it goes pretty much straight across the bone, whereas oblique also splits the bone into two parts, but it comes down at kind of an angle. Spiral, what they're trying to indicate with this one is that it's kind of an oblique fracture to begin with, but then the pieces rotate around one another. Comminuted means that the bone breaks in more than one place, meaning that it creates more than just the two pieces that we were previously talking about. So then non-comminuted is another one, and that would just indicate that only two pieces of bone were created by the fracture. Avulsion is pretty specific to the ends of long bones. This, for example, looks like a joint within a finger, and this is the end of, let's say, a metacarpal, and just the little piece, the little end there, is fractured, and that's what's specifically an avulsion. Butterfly, we can see here, the bone is technically broken into two parts again here, but we have a almost triangular shape piece coming off. Segmental, it's broken off into segments. Green stick, we have bending of the bone and also a little fracture here. So this is another kind of incomplete fracture, but at the same time we also have bending here. So that's going to be pretty characteristic of children or pediatric patients because their bones are so much more pliable. They aren't yet hardened yet, so they're more prone to bending. And then finally torus, it's almost kind of a compression pathology going on where parts of the bone are compressed into one another, creating kind of this outward movement of the bone. Okay, so let's move on and just take a look at a few X-rays here. In fact, let's compare them to our list here and see if we can identify what's going on. So in this one, the main fracture we're going to be looking at is right here. It looks like it's a closed fracture. Now, closed means that it hasn't pierced through the skin, so it's still under the skin. On the other hand, the other side of that would be open, so meaning it's pierced through the skin. And it's close here. We would need to see the patient to be sure, but it seems like we still have some skin intact, but it's getting close there. From both views, we can see that it's just broken into two pieces. So this being one piece and then the other piece being up here. It's also been displaced, meaning that it's not still in line with one another. We can see over here, although this one is broken, on the transverse picture here, everything is still in line. That would be non-displaced. Whereas over here in this X-ray, we have a displaced fracture. These are no longer lined up. So it seems like, based on what we've learned so far, this is displaced. It's also I'd say closest to transverse fracture. And then it's also considered non-comminuted here because it's broken only into two pieces. And it is also a closed fracture. So a lot of different descriptors for just one fracture that could be used. This one's going to be our very specific one at the end of long bones that I was talking about. Here we have the base of the tibia, and its little basically protuberance here, which is actually the medial malleolus, has broken off right here. And again, we see more of a kind of transverse fracture happening, but the main terminology to use here is going to be avulsion. This is an avulsion fracture. It can also be termed comminuted because it's resulting in only two pieces. So one piece here and then another piece there. And I'm sorry, we also have another one here that's also an avulsion fracture. We can see just a tiny little bit here has been broken off. All right, and lastly, we want to take a look at a picture of scoliosis. Now, this is not technically a trauma view for the skeletal system. This is more congenital, meaning that the person's most likely had this from birth, although it can develop into old age. But most of the x-rays you're going to take are probably going to be of pediatric or young adults trying to see the status of the scoliosis. One thing to remember for scoliosis is there's not only a lateral curvature, which we call this view here. If we were to ask this person to turn to their side so we could take a lateral view, we might also see some rotation, meaning that one half of the body may be naturally more anterior than the other. And just basically a twisting and a curvature, basically from anterior to posterior as well, can be associated.